to, I was working in state government, in Punjab government for some years. Then 2004, I came to Canada. Then I gave my licensing examination, NAVLE, CP, everything. And now I am practicing. I have my own, I have got two practices. Then I also do, I work with the federal government. That is what the basic. Recently, I did my MBA from Boston. Oh, can you see this? Can you see this now?
Yes, sir. Yeah, Dr. Brar, you are with them. Yeah, I'm sorry, there was some problem with the internet. Now it has been resolved.
My screen?
Yeah, I can. Yeah. Thank you.
So, this is what my background is, and I have, as far as my family is concerned, I've got two boys. My elder son is in university now, and I love small animal medicine, and I am quite dedicated to provide a good quality veterinary care. Like it's a passion to be working on it, and like we are setting up more, becoming more corporate in it, and also we're going to launch a project. We were going to launch a project in India also, but because of COVID, our project got delayed. But we're going to work on it as soon as the health situation gets better. That's a little bit about my background. And Dr. Sani has been my friend since '87. Very hardworking, very dedicated person. Few people who are so passionate about work, and I really respect him. And it's an honor to be working with him and talking to you guys. So okay, let's start.
Okay, yeah, sure.
If you have any questions, please be free to. You can actually send me an email, or you can.
Yeah, we can discuss the questions in the end.
Okay, so pain. The question is, what is pain? Pain is something which is a very, very important thing, and in veterinary medicine, it's increasingly getting more and more important because people are very, very compassionate, and they really want a good care for their animal, and they will pay a lot to make it happen. So I'm going to talk a little bit about what is pain. What is the pain pathway? How do we identify if the animal is in pain? Somebody somebody mute please? I can hear some background noises. So, like, if it is, a lot of people will ask me, "Oh, my animal never cried." I don't think it's in pain. So we have to, as a veterinarian, as a professional, it's our job to be able to identify why the animal is in pain, and also justify to the owner that what you think the animal is in pain. Then you have to also understand what are the consequences of pain on an animal. What are the consequences of pain on animal? So what are the consequences of pain on animal and the owner? So I'm a clinician. I'm not a scientist, so I do not have much. I'm not very good at theories and stuff like that. But I will give you a brief idea about what theories are and how you can understand more. There are some organizations which are dedicated a lot to pain. There are also some certification programs for pain. I'm pursuing one, which are very, very important, and which will be able to give you a very good idea and also increase your weightage in the market too. So let's start off with, right? So pain is basically an unpleasant sensory or emotional experience with actual or potential tissue damage. Meaning to say, sometimes it may not be always be that you have a tissue damage. Sometimes it could be an animal just perceives that there will be something which will be, as in the past, there's something happened, you gave a shot and the animal thought, oh my God. Or somebody else gave a shot and the owner thought, or the dog thinks, oh my God, this is going to be of something of pain. Especially when you go towards the rear end of a small animal, maybe dog or a cat, especially more in dogs, they cannot see behind, and they kind of perceive, oh my God, it's going to be painful stimulus. somebody took a temperature in the past, or even if somebody did a per rectal examination, maybe you don't even know, and then it's perceived, the animal perceives this is going to be something which is going to be very painful. So they might react. So you have to be careful when you're examining an animal that they, suddenly they react, and why they reacted, that is what comes with experience. But I'm going to talk to you so that you guys can understand and just not be blindsided to it, right? So there's something called nociceptors. Nociceptors are pain receptors. They are basically sensory neurons that responds to damaging potential or potential damaging stimuli. So it's a possible threat, right? So this is something which is how the brain perceives the pain, right, or threat. Uh, Again, I would say that if something I speak which is probably a little bit different interpreted in India, then I would be open to any kind of discussion about it. So this is what I understand, and this is what I have read. But there might be some different interpretation. So same thing could be sometimes interpreted two different ways. This is science. We can have same thing and many different ways of looking at it. So nociceptor is pain receptor basically. So there are different kinds of, like you see even here, there are different kinds of it. I won't go into too much detail of this because this is a big topic in itself. This is just a brief touch about the what nociceptors are. And then this is what clinical signs of pain can be different. They can be, an animal could be howling, could be chewing themselves. Sometimes the animal kind of goes into submission, they're hiding, or they become extremely aggressive. So both could be signs of perceived pain. But you have to understand pain, you have to associate those change in behavior with some incident which took place. Either the animal was underwent a surgery, or the animal underwent some had some medical problems. Uh, like even if some small animals I've seen is you give them a shot and next to the owner keeps crying, "Oh my God, what did you do to my animal?" It's kind of shivering. It's basically pain. So we have to correct that by giving an appropriate medication. So pain can be, the clinical signs of pain can be pretty varied, uh, but we have to always associate this thing with the possible uh, cause of it. So basically, whenever you talk to an animal, you see a change in behavior. It's always good to have a very good detailed history as to what happened. Maybe the owner didn't even think it's of any relevance, but try to talk to them in detail as to what caused it, uh, what happened before this went. Like a couple of days back, I had an animal come in with me, and the rear end was paralyzed. The owner said, "No, no, no, the dog is not in pain." Like it was hard for me to actually convince the owner that the dog is in pain. So you have to actually go back and try to understand. You see the heart rate and all that stuff, but you have to be, the basic idea is if you know what you're talking about, it'll be easy for you to be able to get onto the point. So sometimes you have to also bring the pain scale and show that this is a pain scale, this is what's happening. But I'm trying to give you an idea. I can't really make you experts in one day, but some thoughts to think about. This is a dog in pain now. So this person is doing an orthopedic examination, but look at the dog's behavior, right? It looks like sedated, little docile. This is a typical signs of pain. It could also be recovery from a surgery, but still, even if it's a recovery from surgery, I would still, if it was coming to me, I would still give him a pain medication because that will prep the dog up. So cats are a little bit more confusing. Cats can sometimes hide when there is a pain. Now, the owner may not actually see the cat for days together, and he thinks the cat is coming and eating, so cat is fine. But if the cat is hiding, that means the cat is not normal. And if the cat is not normal, the first thing which we think is there pain? Did something happen? Especially when the cat is older. I've had male cats who got blocked, the FLUTD, we call it now FUS, and it's extremely painful. But the owner said, "No, no, I think the cat is fine. Did it use a litter box? Yeah, it's going to litter box. Did it pee? Couple of drops." So then wherever you get a point, then you start off there. Because I'm talking to you from a clinical point of view. Now, when you go towards an academic point of view, there it becomes a different way of looking at it, because here we always deal with an animal, with an owner. So you have to actually be able to interpret the whole thing and talk to the owner so that you are able to come to the appropriate conclusion, and then you can proceed. Because if you're not able to come, the owner will never take a pain medication, and the dog will never recover. So what are the causes of pain? I'm going to talk to you a little bit about causes of pain. um, I'm doing this for the first time, so I may not be very smooth and very agile like somebody who does it every day. So please bear with me. I'm more of a clinician. I'll try to do my best. So like we have to do understand what can cause a pain. Most pains in small animal are caused by trauma or injury. It could be a dog fighting with each other. uh, it could be post-surgical. A lot of times when it happens is, especially when we start off the practice, and this happened with me, was we used to do a surgery and we think, oh, he'll be fine. But it doesn't happen like that. You have to understand that every surgery is painful, even if it's a minor surgery. So it's appropriate to give a pain medication with surgery. If especially if it is an orthopedic procedure, if it's a dental procedure, then make sure that we understand what dental blocks are and we do them. I've seen people take out the teeth without dental block. It's a very painful procedure. Uh, Dogs can die because of that. If it's an eye procedure, it's very painful. There's some medical conditions which can also be painful. For example, if an animal comes to you who is having a gastroenteritis, you suspect gastroenteritis, you suspect the dog or the cat has some kind of vomiting or even parvo for that matter. Uh, then there's a chronic, uh, like especially okay, then you need to think that the animal could be in pain. Look at it, and I start pain medication as soon as possible because I don't want the animal to suffer. The basic idea is when you are working with an animal, it's important to understand. You always perceive, if I was there, what would I feel? If I have gastroenteritis, it's very much possible that I could have pain. So it's important to address that. There are different pain. I'll talk about pain medication treatments and what we do it, but certainly you have to first off understand that the animal will be in pain. Senior animals are more likely to be pain, and then they have chronic pain. uh, Younger animals will have more acute pain. They may, unless there's a problem which happened and was never fixed. Osteoarthritis is quite common in dogs and cats, especially who are elder dogs and cats. They're very likely to have an osteoarthritis. One study shows that 60 to 70% of small animals will have some kind of osteoarthritis. The owner comes to you say, "Oh, my cat's not jumping. Cat's not. It's senior cat not going inside her litter box." So assume it could be osteoarthritis. Every time they may not allow you to do a radiograph, and even if you do a radiograph, sometimes osteoarthritis is not easy to diagnose. But assume it's osteoarthritis. Giving a little bit pain medication will be something which I would advise you. Of course, this cannot be done on your own. You have to actually talk to the owner to be able to discuss with it. There are a lot of things when people say, "Oh no, my cat is fine," or she just doesn't like to jump on the bed, and then you assume, why would the cat certainly not like to jump on the bed? Oh, my cat just doesn't is not being inside. Oh, maybe because we moved, maybe because this happened. Yeah, that can be an issue. But then also understand is that pain is a factor, and a lot of times if you just put them on pain medication, problems will solve. Believe me, if you are able to understand this thing and do it, you will be a very successful doctor. If you're not able to understand, you will struggle. Sometimes the pain may not, there may be hyperalgesia, something which we have to take it seriously, because if an animal is in chronic pain, small amount of stimulus will make it worse. Uh, I recently we were treating a dog. The owner was, it was like a, I don't even know why the owner was having that dog. He never really cared about it, and the dog had. I wish I had the pictures here. The dog had a really chronic skin problem, and I had treated the dog before, but it's like a very difficult situation when the owner is not willing to go forward. Anyway, so when we did a surgery because the dog had mammary gland tumor. Uh, oh my God! The moment I touched the mammary gland, it was as if the sky is going to fall. The dog was kind of very quiet, docile dog. Suddenly turned around, and a technician said, "What happened?" I said, "Oh, this is hyperalgesia. We should have blocked it probably with local anesthesia before we touched it." But hyperalgesia can sometimes really surprise you. You just touch it, and the dog or the cat kind of tries or begins to attack you as if, and you never expect that. So my thought is that try to always see, try to be very vigilant when you are in a clinic, in the examination room. You should have the eyes of an eagle, the heart of a lion, and the fingers of a lady. So you should be very soft in touching, where you have to notice everything from right from the mouth to the rectum. There could be any small thing which could make the whole thing change. I have example after example in which, like, if you miss it, you have missed it. There could be sometimes a very subtle sign which you never even expected, but that subtle sign could make the whole difference. So sometimes it's just a perceived noxious stimulus. Hyperalgesia is also perceived. The owner thinks you're going to cause the pain. You may not be able to cause the pain. Uh, it's more when you do a rectal temperature. It's always assumed two parts the dogs or especially dogs will be more sensitive to. One is their underbelly, and one is their rectum. Of course, ear and feet are also something which are very important, but rectal temperature can have, because you are trying to do it quickly. The dog or the cat doesn't care that you are short of time, so you have to always properly restrain it and do it. Don't We are not looking for superheroes. We are looking for people who are consistent and good. Even if you're a superhero, doesn't will not make you take you far. So don't try to be superhero. Try to say I can do this thing very good, but no big deal. We are looking for people who go from head to face consistently, right? And you will gradually become better. So there's some pain scales which are a lot of literature is available. I am going to cover a little bit about it because my timing is short, and we are not talking. I can go over one pain scale for 1 hour, but I'm not going to go today. The Glasgow pain scale, Colorado. There's some pain. I like Colorado pain scale. It's simple. It's easy. There's an SDS pain scale. Uh, these pain scales are good, but you can put a picture of the pain scale on your wall or your office, or these days you can have it even downloaded in your cell phone. Uh, Basically, you go through it repeatedly so that you understand what they're talking about. Now, understand one thing is that whenever you look at a literature, the dogs or the cats don't read books, so you have to. It is your understanding or your interpretation of the same thing which is going to make a difference. Now, these days, the colleges, they want you to actually record that on your file to say what was the pain scale. AHA has laid a lot of emphasis on pain, so it's becoming more and more important. I remember when I was in vet school, we never took pain seriously. Okay, fine. So what? No big deal. And even over here, they used to think, oh, if the animal is little bit of a pain, it's better. Then the animal will not hurt itself. For example, if the animal is limping on the front leg and you do not give pain medication, they used to feel, okay, now the animal, because in pain, it will not hurt itself. If you give pain medication, it will be able to, it will feel good and it will hurt itself more. But that isn't correct. So basically, you have to look at the facial expression of the animal, their body movement, crying, physiological indicators, heart rate, respiration. And there are also some biological markers which you have to take into consideration. Now, heart rate, respiration in a cat can sometimes really be can confuse you, because if the animal comes to you, they're already under stress. So that is one point. But you have to also look at the overall body picture. how do they look? So that is, you have to interpret those things. There are some newer devices like this thermoregulation. Um, they are being worked on. It's some people think they are working, but it's still not fully acceptable. So this is a Colorado pain scale. You can look it up. It's available on Google. It kind of gives you an idea as to what kind of behavior you're expecting. This is for a pain scale for cat. The more you understand it, the better you'll get, and the more results you will be able to get. See, with my age and your age, as when you guys get to my age, pain will be a very, very, like, it's important now. But if you if you don't address it, you will be called a butcher. This doctor is a butcher. This doctor is has no passion. So you don't want that to be put onto your name. So the other way people say, oh, he's a very compassionate doctor. So the person who's more compassionate is likely to be more successful. Even if you make a mistake in diagnosis and you're able to give a good comfort to the animal, people like it. You might be a very good diagnosis and you're not able to what I say, communicate or give a good interpretation to the owner. He may change you. So these are some signs for a cat, like this is a ear thing. This is very important for you to understand that, because cats can sometimes really be confusing. This is a picture which I took for. This is also from internet. This is the amount of energy excluded. Thermal imaging. This helps in pain. Um, we don't have this right now, but I have attended seminars on this thing, and I think this is something which is going to be more refined, and this is for the future. So you guys should understand it more than I do, because I'm probably at the end of my career. These are some receptors which will give you an idea as to how things are transmitted. I'm not going to go too much detail. I'm not a master in these receptors. Uh, like these are more for academic. For clinically, yeah, you should have an idea, but nobody's going to ask you about that. You are going to be more people who want to be clinicians. They have to be more interpreted into clinical science and management. You have to have an idea as a pain pathway and stuff like that, because that's the way you can think ahead and do it. So pain, I've got a little bit about pain pathway here. So this starts from the skin. It transmits to the spinal cord. From the dorsal horn, it goes to the brain. The brain is what perceives pain. Spinal cord does react, but perception of the pain actually takes place in the brain. So that's something you should understand. It's a little bit more about pain pathway. This noxious, this is transduction, modulation, projection. We go to the cortex, and this is where it's perceived as pain. This is where the memory is stored. That this is a painful stimulus. So animals have a very good memory for pain. My experience says that they may not remember the scent, but painful thing they will remember all the life. So there are different kinds of pain. There could be acute pain, which is physiological. I hope everybody can hear me.
Yes, sir.
Good, thank you very much. Acute pain, which can be physiological. We can have a chronic pain. Not acute pains are pretty easily treatable. You have the animal comes in, you give medication. Most acute pains you'll be able to manage. Chronic pains is where your skills will be tested. Which pain medication to be given, how long to be given, and then you have to also look at the side effects of that. So there's neuropathic pain. This is mainly for nervous system, nociceptive pain and radicular pain. So these are kind of some types of pain. Now I'm going to talk more about the effect of pain. So effect of pain, number one will be on the animal behavior. Sometimes the animal may start limping. There could be stress. They could stop eating. If you did a surgery, there could be delay in recovery. There could be delay in healing process of the wound may not heal for a long time. Like when you go to a CP examination, those who are interested in doing it, pain is something you will definitely be asked about, especially in your anesthesia examination. And a lot of our veterinarians sometimes fail to interpret how seriously they take it, and they fail in it. And I can give you example after example of how people did not understand this thing and gave it. Just giving pain medication does not mean you have stopped the pain. The pain medication is one aspect of it. Understanding the pain is also very, very important. Uh, then there could be change in behavior of the animal. Sometimes the animal doesn't eat. To me, the things which are most important as far as clinicians are concerned is the economic loss, which is the client just moves away, gives you bad review. Those things are very important. The client gets really mad. Uh, Doctor, what happened? Like I had a personally had a CVO case on me, which I was absolutely right, but the owner perceived that we were disasters as veterinarians are concerned. And of course, we came out on top of it later on, but it was a chronic pain with the back, and we were trying to treat it, but she was thinking that she wanted a miracle to happen, which was not happening. But my mistake was we were not able to communicate to her properly because we failed to understand where is she coming from. So we have to understand that if something is painful, we need to explain it to the owner and understand a little bit more detail about the pain, and so we can only if we understand can we communicate to the owner, and that will save you a lot of headache and a lot of time. So I'm talking a lot about symptoms of pain because this is what I see every day, and this is what I want you to be good at. This is something which will make you successful, right? So if I'm repeating the same thing over and over again, it's because this is going to come to you every day in your clinic. Even small things like vaccination can come back to you and haunt you. You think, oh, is it really in pain? Assume first thing that it could be. You may not have to give it a pain medication, but assume it's in pain. Like for example, you treated the animals not eating tomorrow. Now there could be yes, there could be an effect of anesthesia, but it could be effect of pain. I tell you one story, and this is true incident which happened with me. Many years ago, I did a spay on a dog. We thought we had given enough pain medication. Next time the dog came to me, the dog was crazy. The dog wouldn't even let me close to her. It became so bad that the owner had actually got to change the veterinarian. Now, it was a learning experience for me. I went back and thought, what could I have done differently? So then I realized that if I had probably given her more pain medication, then probably it would not have happened. So sometimes we cut short corners, but never try to do it for pain because it can really haunt you in the back. So this is a little bit causes of pain. Cancer is something which I mentioned, pain to mention. There are trauma on the area, neurological problem. All these things can assume they could be painful. The owner is not the dog is or the cat is not going to raise its hand to say, "Oh, I have got pain." We have to assume, right? The dog comes in as hunched. This thing definitely has a pain, right? And this thing probably has a spinal problem too. But pain is something you have to it has to be in the back of your mind right away. That is the animal in pain? So pain management is something which I'm going to talk a little bit about. Uh, I'm going to go in this thing. This is something which I do deal more, so I'm going to be more. This is something which I would like. So ethics of pain management is important. Ethics means that what are you doing to control the pain? Are you trying to brush it under the carpet and mislead the owner, or are you trying to understand the pathophysiology and try to understand all the options you have? In today's practice, brushing under the corner is not going to work because everybody can read it on Google. People come back to you after they have read it on Google and they ask you and they question you. If you don't have an answer, you're probably going to leave it. The best is it will be an unhappy client who will not take your service, or you give them an option and they won't buy it. B is they change the veterinarian. The worst case is they actually complain against you to your board, which will be another $5,000-6,000 for you to at least fix that problem. So we don't want to go. We don't want to get in there. So it's important to understand and manage pain, right? So pain management is something we have to be good at. So this was a very interesting theory, gate theory, which came in 50s. But the best part about this thing was that I'm now talking about pain management. So I'm starting with the gate control theory. I really like this gate control theory because it kind of told you about the mindful based pain management. Meaning to say, if there's a pain management, if this pain, you could actually mislead the brain, or you could have another sensation traveling through the central nervous system, which the brain stops the pain and focuses on the other sensation. So we could actually, there's one noise and then we could produce another noise to stop that noise. So it's a very interesting theory. When this theory came out, it was a very difficult for people to believe this is possible, but it's happening with us every day. You have painful stimulus, you start doing a tickling to your, like, the pain probably is not even focused on the brain, so brain can focus on only one thing. This is something which we use while giving a shot. When you're going to give a shot, try to, I think you guys must be doing the same thing. We just try to stimulate the skin, and kind of the brain does not understand the pain, and can be sometimes may not be that much perception. So we have to use, in short, we have to use everything in our kitty to be able to control pain. So therapy, we have some medications available. Nsaids, we all know, are one of the most go-to drugs. Uh, we often use it. Uh, I'm going to talk a little bit more in detail in Nsaids, but I think you guys must be using it. The opioids are something which are also very effective. Uh, I like gabapentin and tramadol. They're non-opioid, non-addictive, but they are good. Local anesthesia is one of the most underused in veterinary tools. There are two reasons for this. One is we often we don't know. A lot of times we don't know how to use it. We don't know. Like, I'm not talking about you guys. You guys are might be better than me, but a lot of veterinarians don't know how to use it. They don't know, like, what are the blocks, where to give the block. But if you know it and if you use it properly, this can be a real good tool for you. Epidural anesthesia is something which is also in small animal, not very commonly used. Uh, can be very good tool if you know how to use it. Has some side effects, but you have to become good at that. We have some alternative therapies coming up, like acupuncture. I have not talked about CBD oil here, which I'll talk a little bit later. Excuse me. There's something new coming up, a CC loop, stem cell therapy, rehabilitation. Those things are, I'm going to talk briefly about that. See, I'm trying to make you understand that they work at different level. Local anesthetic mostly works at local level. NSAID blocks the pain through COX inhibitors. I'm going to talk a little bit later. And opioids, they basically they work at the brain. They are pretty good and effective, often very commonly used, especially in surgery, but can be used other ways too. So NSAID are, there's some list of NSAIDs, Remedil, Deramax, Metacam. They are good. They are very effective, but they do have their own side effects. Often don't use a NSAID in an animal which is dehydrated. It's good if you could do a blood work to understand what the pathophysiology of the animal is, but sometimes money makes you stop it. If you one more thing I've seen, and I would tell you about practices, if you know what you're talking about, it's easy for you to be able to talk to the owner and get them onto your side. If you don't know, which experience is a factor here, but if you even before experience, even if you don't know what you're talking about, you will not be, the owner is not going to buy it, because the owner comes to you with, oh, my dog is limping, and he thinks he's just going to get a pain medication and go away. And you tell him, I need to do an X-ray, I need to do this, I need to do that. So he came in with an expectation that it's going to cost you $100. Your bill ends up being $1,000. So how are you going to bridge that gap? That gap can only be bridged if you have the knowledge to do it. And of course, experience is a factor, but if you don't have the knowledge about it, then you will never be able to justify that. Your body language will never be able to, the owner is never able to buy it. See, right now, I've been in a practice for long enough. But with God's grace, 90% of the time, if I talk to the owner, they are able to I'm able to get them on to do whatever I want them to do. That's not doesn't mean that I'm really some superhero. It only means that you have to understand what you're talking about. So anyway, let's go back to the theory. So the NSAIDs are basically blocking the COX inhibitors. So like what happens with the COX inhibitors is prostaglandin production is decreased and the pain of the inflammation is reduced. But then again, if NSAID also they block they can damage the kidneys, and NSAIDs can cause uh, gastritis, can cause them to animals to vomit and all that stuff. The thing is that often when you use NSAID, if you could do a blood work, it would be really good. But along with that, try to give some kind of gastroprotectant. And the other good side effect with NSAID is you can't use steroids along with NSAID. So it can cause ulcers in this. So opioids are something which are often very commonly used. Like there are a number of list of opioids. They have all have different levels of action. Commonly used in small animal over here is hydromorphin is very commonly used. We use butorphanol, buprenorphine. They are good. Uh, like morphine is not very commonly used, but morphine is also not a very good pain medication. I would prefer hydromorphin. It's cheaper than most of them and quite effective. The only problem is it can cause nausea and vomiting. So, but the side effects with them are they are often you have to have logs of them, which can be sometimes be real. Like there are more than one department involved. DEA, the drug enforcement agencies are involved, and so you have kind of have to be very careful with them. Often they use in combination with other drugs. They have an addictive and abusive value. There was a case here in Canada a few years ago. There was this lady who used to work as a veterinarian, and she used to steal ketamine from the clinic and used to use it for with her husband to kind of sedate people. It was very prominent in the headlines many years ago. She used to work in GTA area. So they kind of after that incident, they have become very careful about ketamine and misuse and you have to have a log. If they had an opioid crisis in the United States, we were lucky we didn't have that, but it's something you have to be very careful about. But they're very effective. I like them because they don't produce gastritis and stuff like that. They can produce nausea, but often they do not damage things like the NSAID does. So sometimes we use a combination. That way we can decrease the dose of the NSAIDs. That's a decision you have to make clinically to and see the condition of the animal and make a judgment as to what would be the most appropriate. But certainly the opioids are something which are very effective. Government, I love it because it not only blocks pain, you don't have to have any kind of logs and stuff like that. It's readily available. It can be used for neuropathic pain and chronic pain. It has anti-seizure properties, but research is being done. More and more research is being done on gabapentin. I'm sorry, my lips are a little drying up, but it's a very effective drug, and I love it. You can give it in cats without the damage of kidneys. There was recently a case over here. One of our Indian veterinarians, she gave it Metacam to the cat. The dose was fine and everything, but the cat had renal failure. It went to the college. She got out of it, but it certainly was very stressful for her because she's thinking, oh, I did everything right. Why are they doing it to me? So you need to give to make sure the animal is not dehydrated. I always, whenever I do NSAIDs on cats, especially Metacam, I give them subcutaneous fluids, making sure that if a cat didn't drink, especially if it's in surgery, we don't know the owner gave water or not. We don't want a problem happening, and then having kidney damage and the owner coming back to you. It's better that he goes back and is happy. CBD oil is also very effective. The issue with CBD oil is we are still not being allowed to use it freely. It looks promising. There are some legal issues. It's available. The funny thing is, it's available over the counter, but as a veterinarian, we are not being allowed by a legal thing to use it freely. So I'm not going to talk much about it. It's effective. I've seen it. It has got seizure properties, which also has got pain medication properties. People say it's addictive, but beyond that, I will not talk much because we are not allowed to talk much about it. Other pain medication techniques which I have found very effective is acupuncture. I have done a course in acupuncture. It is very effective. If you know which points to use, you can do miracles. Of course, acupuncture has to have along with it herbal medication. If you can combine it, it's a very potent combination, and you will be very successful. It's not voodoo. It's not something which doesn't. It works. Laser therapy is something which we do over here, and laser therapy helps in. It's called photo. It's not called photomodulation, I believe. It has a lot of activity. It can help in wound healing. It's very effective in pain medication. Chiropractor is getting increasingly common in veterinary field. You have a spinal problem, you send him to veterinary chiropractor. I recently have a case now. I'm going to do the same thing. Tell you one example. I think we have time. A few years ago, I had this guy come in to me. He was a client of mine, old guy. He had a dog who had a one day the dog suddenly couldn't move from the hind of water. He called me up and we examined the dog. Um, he was saying, "Oh, let's put the dog down." I said, "Okay, you give me 1 week, a couple of days, and if it doesn't work, we will put the dog down." We did chiropractic treatment on the dog. The dog started walking. Was never I wouldn't say it was 100% normal. Was close. Lived for another. It was Dog was already at that time when I saw him was about 11 or 12, but it lived to be another 14 years, 2 3 years, and then after that it died for some other reasons. There was one another example I saw a couple of years back, and the dog was. I do house calls, so sometimes when you go to the house, you see a lot of other things. The dog was paralyzed, was kind of lying flat, and the owner saying, "Oh my God, what am I going to do?" We did a chiropractic treatment, and the dog started walking. I've not been in touch with them for after some time, but that at that point of time, the dog became almost close to 100%. So chiropractic treatment are good, especially when we have spinal problems, intervertebral disc disease, and all that stuff. It works well, but you have to know what to do and have to have. I would always advise, if you don't know, then probably refer it out so that you know what you get a good treatment. There are some human chiropractors who do animal, but it works. I don't know if it is there in India, but I'm just giving you an idea. Uh, Rehabilitation therapies are also effective if there are a lot of things available. This thing's a lot of things. This thing is available online too. There's a certification program now in rehabilitation. If it is done properly, can mitigate the pain, especially post-surgical orthopedic problems. We have FHO, like femoral head osteotomy and stuff like that. You need to do rehabilitation. You have got you did a cruciate ligament surgery. It's important to do rehabilitation because without that, the animal will never come back to full movement. There's something which I need to talk to you about, the CC loop. This is something new which has come in. They're talking a lot about the advantages of this thing. I have personally never used it, but I have had attended the seminar, talked to some people. They found it to be effective. I'm thinking of using it and trying it out because a lot of times you just can't solve a problem in spite of all these things. So these things, the acupuncture and stuff like that is good, but this is something the owner has around the dog, and it makes them feel more comfortable, more. Oh yeah, something is working on it. The other natural therapy, we are lucky to be from India, and turmeric is something which is really good. It reduces inflammation. It has effect of arthritis. It's something which is good. If you know these herbs, you will actually have an edge. But the issue is that you have to know it, and you'll be able to justify why you're using it. Assisi, this is what an assisi looks like. Uh, I'm sure this is you can look it up online. You guys are smarter than us because you guys are in young age. So this is local anesthesia is something which can really be effective. You do dental block. If you don't use a local anesthetic, you probably have created a problem for yourself. Like you do a declawing is becoming illegal, but when we did declawing, it was a very effective thing. A lot of other surgeries you can, like for example, you do a spay, you give a lidocaine splash along with that, your animal is going to recover better. You do a surgery, you give it block, you will have better results. It's very low cost, uh, very effective, and the only thing is you need to have the knowledge of this thing, and you need to be able to more than knowledge, you will be able to make it part of your personality to use it. So this is something which I would encourage you to do more work on. This is a little bit about physical therapy. There were treadmills and stuff like that. They do work. I've seen very good results after this thing. Hydrotherapy is something which we also do. This is underwater treadmill, getting more increasingly common. People charge for sending the dog in. Works well. A lot of chronic problems can be resolved. Some clinics have it in their working too. I know our senior Dr. Dhaliwal used to be our pathology professor of pathology. He's got a clinic in Michigan. A couple of years back, I went to visit him, and he has got an underwater treadmill and quite effective. You can make some good money in it for doing some session. Overall, we're going to talk a little bit quality of life. See, if you do not treat it, the animal's quality of life will suffer, and the owner might end up putting the dog down. Uh, Something which happened with me many years ago, and I cannot forget it. Probably put me on the path of pain medication. I had just started working in Canada, and I had a dog come in with me who had a leg problem. Uh, we did an X-ray on it. We knew there was a problem. I was still trying to understand what to do. I was a doctor who used to do NSAID treatment. That's it. It obviously required more than that. It probably required some kind of a intra-arthritic joint, like something had to be injected in the joints. Uh, we were not understanding that, and a couple of days later, I came into the shift and I saw a dead body of the dog. The owner had put the dog down. It really hurt me. It was a very beautiful dog. I was thinking, what could I have done different? How could this have been prevented? I took it as a personal defeat because I thought of course, I did not put the animal down. I would probably have convinced the owner not to put the animal down, but one of my colleagues put the animal down, and it was a painful situation. So things like that sometimes affect you in your career, and then you start on to a different path as to how you could manage this better. I do a lot of research on pain medication. This is something I'm really passionate about. So I talk a lot about it. I read a lot about it, and I've been to a lot of conferences about it. There's some things which I might be able to talk to you today, which you may not have heard, or something which I'm just you might be doing it all the time, and I'm just trying to make you aware of those things. Whatever it is, I hope I am able to make some impact on your life. Uh, this is something which is becoming more important and is more as far as I'm always going to link this thing to finances of it because that's what I do. And every day, every procedure we do, there's a financial link to it. I'm not an academic, so I don't really go in for research papers and stuff like that. We do, but very limited. My talk is always going to be associated with finances of it. I hope I am not stepping on wrong toes and I'm making you upset, but forgive me. That is what I do every day. So this is something which is getting important. There's a course for it also. Hospice care and sorry, palliative care is something which is getting increasingly important. It's the days when the animal is suffering and the people say put it down are over. Now, a lot of people will want you to, especially Indians, will 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 not like to euthanize their dog. If you have an Indian client, most of them will not like to euthanize their dog. Um, Chinese, okay, let's not go there because then it becomes that's a different thing. But some clients will not like to do it. So then you have to understand how do you provide the care so that the animal doesn't suffer. This is a very good organization, and they've got courses, they've got some certification program in which you understand pain is something which is very important in this part, because it's a chronic problem. Could be having, a dog or cat could be having a chronic arthritis, could be a cancer sufferer. You have to understand what drugs to use, and in this case, all drugs are not at your disposal. You have to be very selective. You have to understand what problems are there. So this is something which is getting increasingly important. It's a good money making too, but you can make money only if you know. Uh, so these are some organizations which are doing a lot of work about pain management. I AHA has some guidelines, and again, forgive me, I will use American because I'm used to America. I don't know about Indian organizations. I'm not dealing with them. I don't even know much about European organizations. There might be some organizations which are doing very well, but I'm not aware of them. I am aware of American organizations, so I'm sorry if I am probably not able to include some Indian names in it or some European names in it because I am not aware of them. Like one thing which is always there in America is they always think they are the best. They may not be the best, but that's what their perception is, and they think Europeans are B grade. That's what the most Americans would think. Uh, anyway, this is just background. So there's some organization which do a lot of work. AHA is a AHA has some guidelines for pain control. I'm talking about CDMA also does some pain control work. These are some organizations. This VSAG has a very good site. This has got included a lot of drugs on it. You can probably look up almost any drug. You don't need to go outside at your level. If you have this VSAG site, it can provide you almost answers to any questions you have for basic clinical work. So I would encourage you to be there. IBES is an acupuncture society. There's also another guy in Florida. He does an acupuncture course online. I don't know if IBES does it online, but Chi does it online. You can actually go online and do some courses on acupuncture. It's effective. I repeat myself again. It's effective. Seen real good results with that, both in pain management and medical management. So this is what I wanted to cover. There's some articles recently written articles and some older articles which really are something I went through and I like them. Dr. Sani is an expert in this thing. He can give you more idea. In the end, I would say if you can manage it, you have a happy client. You have a happy client. You have a flourishing practice. You have a flourishing practice. You are respected and reputed, and you make good money too, right? And you can sleep well at night. There's some references which we did on this work. In the end, I would say any questions. I'm open to any questions.
Okay, thank you, Dr. Pushproop, for a very nice and exhaustive talk. Can you hear me?
Absolutely loud and clear.
Okay, thank you. So I've got a couple of questions myself. So okay. How about medical marijuana, CBD? First question. How much is the use? How much is the use?
I told you about it. It is effective. It works well. We have
no, I know that, but how much is the availability and how much is the legality? The legality part of it, is it allowed in Canada or?
It will depend upon province to province. In Ontario, we are not allowed to use it much. CBO has some restrictions on it. It's available online. You can tell the owner, but you have to be restrictive in your use. You're not allowed to use it as a veterinarian. You're not allowed to. You can give a guidelines to the client, but you cannot really be open about it. So it's kind of, we are still working on it. There are some restrictions on it. There are some legal issues about the whole thing, especially in Ontario.
Okay, it's the same thing as Rick Simpson oil, RSO, right?
I'm not aware of that Rick Simpson oil.
Okay. How about its anti-cancer properties?
It has got good properties. It works. It has got anti-seizure medication, pain medication, and it has proven to be of anti-cancer too.
Your speaker is I cannot hear you well. Can you please?
Those things are those things are, I see CBD oil is something which is very effective. It works very well. The best results I have seen with CBD is for seizure medication.
Seizures.
Yeah, epilepsy, seizure. It's got very good effective results. Sometimes phenobarbital, other drugs, they fail and CBD works. Or you can give it as a combination too, for seizure medication. But
I
pain,
understand.
it it
What is
does
the
work in
mechanism
pain
of
too.
CBD in as anti-seizure medicine?
Sorry.
What is the mechanism of CBD oil as anti-convulsant?
I that part I don't know, because we've not done much work on that. We don't use it, so I don't know much about it.
One more question. What is this magnetic therapy?
Okay, this is something which is coming up new. We don't use it very commonly right now, but you have machines in that. I can send you a link later on if you want me to. But we have some special machines in that, in which you can. It's basically based upon polarization, right? But it has worked as in pain medication. It has worked in other diseases too. But pain is something which is the thing with pain is that it's very palpable. You can actually see a difference. If you have got a good pain medication, you could see a result within 24 hours, right? So it does work in pain medication, other medical problems, but the results are very palpable in pain right away. There are certain special machines in it. We have never used it, but I have read about it, and I have I don't think I've done any webinar about it, but I've read about it in certain research articles. So I included it here because it's something which is coming up.
Yeah, I've got few questions from the students. I'll have to read them because they have been muted. The first question is, can you elaborate more on customer relationship part, like considerations, precautions, preventions, and the limit to disclose conditions and stuff like that?
Okay. Do you want me to address them individually, or do you want me to address them all together? I can start off.
Yeah, all together, because they have been muted, so you have to address all together.
This is a very interesting question, and something which will be, if you understand this thing, it will be pay you a lot. Because there are two things in it. See, when you're dealing, when you're in a practice, you should understand the animal is not going to talk. It's the owner is going to talk. You are not only dealing with the animal, you are also dealing with the owner and a perception of the owner. Now it gets a little complicated because it may not be one owner. There might be husband and wife, and both of them have a different perception. So when an animal comes in, I can explain to you how we do it, and then you can interpret how you can do it in your personality. There are personality. First of all, you have to always be very calm and open and try to understand what the owner is talking about. When the owner comes to you, oh, my dog is not doing good. That's a very, very vague statement. You don't know if the dog is not eating, the dog is not sleeping, or the dog is limping. So you have them ask them open question as to, can you describe me what exactly is happening? Then when you start talking to them, there will be certain points they get defensive about. Now you have to go around and ask the question. If you ask them directly, they may say, oh, I don't need to answer that. Like, so you need to understand is your questions have to be framed in a way. Well, this is a full lecture. I could do full training on this thing. It's very interesting.
Okay.
But
Next question.
I'm not done. Let me explain that to you. So as far as disclosure is concerned, the more you talk to them about a particular thing, the more they understand. But one thing you should understand is you have to be sure as what you're talking is relevant. Like if the dog is limping on the right leg and you're talking about the head, it obviously is going to make them feel, what's the doctor talking about? So you have to understand, be relevant, and you need to talk to them, and talk to them with confidence, and try to give whatever you can sum it up in a couple of minutes. First 15 or 20 seconds is the time when you have to create an impression. If you miss that, it will take you longer time to do it. Okay, next question.
Yeah, the next question is from Pulkit. He is asking, Does the action or does the potential of behavior modifying drugs on different breed of dogs remain same? Well, I guess not. Is there breed tolerance, and if it differs, how do we decide the dose? Well, it's a different question. Behavior modifying drugs, of course, analgesics can act as behavior modifiers, but he's asking whether behavior modifying drugs actions on different breeds remain same, or it is there's some breed predilection.
Okay, this is a very loaded question.
Yeah.
I would say yes and no.
Hmm.
Breed does play a role, definitely.
Hmm.
Most of the drugs, when you go through the literature, like, you cannot be an expert on all the drugs all the time. If you go, let's say, you're going to use a particular behavior modifying drug, you have to, before you actually use it, it's good to go through, like, I go through Plum, but whatever books you use, go through that, and most of the time it will be written if a particular breed is sensitive to it or not.
Yeah.
Breed do make
Hmm.
a role, but it's not always a defining role, meaning to say you can't use it in other breeds. If it's contraindicated, it's written very clearly, so don't use it. But sometimes it says, like, don't use it as a combination. So whatever is there, try to follow it. Sometimes we go beyond that thing. We are sure what we are doing. That's a different story. But to start off with, yes, the breed does play a role. But like, there are thousands of breeds and thousands of
Hmm.
drugs. You can't really
Hmm.
be an expert all the time. So you have to follow the literature and have a good textbook with you available so you can go through it. There are online resources too available. I use a lot of Win, but Plum is my go-to book.
Yeah, next question is from Sajdeep Kaur. She's asking, can you tell me about some physiological therapies for animals? Okay, okay, she has revised it now. Can you tell me about some psychological therapies for animals to relieve pain? Psychological therapies to relieve
See,
pain in
psychological
animals.
therapy, if you're talking about drugs, there are, I'm going back to that. We have some behavior modifying drugs. They recently were doing a research on it, and they found that certain supplements, especially for liver supplements, can play a major role in the animal's perception of fear, and also animals' response to loud noises and stuff like that. Purina certainly came out with some supplements which are, they claim to be effective. I have never tried them, but I was at a webinar with them recently. So that's something which is of a role. Now, when you're talking about pain, pain definitely has a psychological point in it. But I would start off with more with pain medication and then talk about psychological behavior. But yes, if it's a perceived pain, then the um, the NSAID or the opioid will not be effective. You have to look into a psychological point. Sometimes even simple thing like taking a dog for a walk with you, with the owner, kind of changes it. But be careful. Some dogs do bite. We had recently, not recently, but a couple of years incident of one of our PAU veterinarian who was trying to be adventurous and had a bad dog bite. So be careful with that. But yes, psychological therapy is something you have to consider if it's a perceived pain. The psychological therapy can come in by being with your body language. It can come with your trying to be more open with the dog. There are some drugs available which you can use them too. Tramadol is also has psychological component in it. So it depends. Yeah, but if it's a perceived pain, certainly we look into psychological aspects of it, how we can overcome that.
Yeah, next question is, yeah, I see a lot of vet practitioners in India giving butorphanol over NSAIDs, even in cases of mild pain. Naturally, the pet is relieved of pain very quickly, and the pet parent or the owner is happy. Is it morally and ethically correct to use butorphanol or other opioids even for mild pain? I think it is self-explanatory. It is not morally correct, right, Dr. Pushproop?
Um, it depends upon
For
what you
mild
think.
pain, for
Yeah,
mild pain.
yeah, it depends upon what you think. Butorphanol is expensive. It's
Huh?
expensive. Butorphanol is pricey. I wouldn't use butorphanol for pain. Butorphanol is pricey.
No,
I would
she's
use.
asking. or he is asking whether it is ethically and morally correct to use opioids for mild pain.
Okay, there's no straight answer on it. It depends upon what you think is correct for you. It's not wrong, but that is something which you have to decide if you think it is fine with you. Honestly, if you talk to me about the action, butorphanol is not that much of. I would use an NSAID over an butorphanol, but again, it depends upon. Butorphanol has only couple of hours of action. NSAID has got longer action. Butorphanol is more pricey. Some people like to use more. They try to use more like bigger names to make more effective, but that doesn't always is correct. So it's a personal decision, I would say, but not ethically wrong, not ethically wrong, but it's a personal decision.
Okay, one more question. You said, okay, it is about behavior modifying drugs in pets in class. Sir, you said to ask about, okay, behavior modifying drugs. We had actually lecture on behavior modifying drugs. So that's why people were asking about BMDs. Okay, one more question is, could you ask to please elaborate chiropractor more because it is not practiced frequently in India? What are its advantages and how helpful it is in animals? The chiropractors, he means to say.
Yeah, chiropractor. Okay, it's just it's a full lecture in itself. But summing it up, chiropractor. If you have got a spinal problem, it helps. You have got diseases like intervertebral disc disease, which is a very painful disease, happens suddenly. You have it paralysis of hind part. They are helpful. Most chiropractor over here, excuse me, are both animal and human chiropractor. There are some colleges which are specifically for veterinary chiropractor, but they are more horse practitioners. Small animal is coming up, but it's not. It's I don't know of anybody who's specially only small animal chiropractor. I know there are horse practitioners who do chiropractor in small animal or human chiropractors who do animal as well. My
Okay,
experience with them has been good and
I think you
effective.
cannot answer this because this is how frequently it is practiced in India. I don't think anybody of us knows about chiropractic in India. It is there in humans, but I don't know about animals. And one more question is how pain caused by hyperalgesia be reversed to normal? Hyperalgesia.
That is okay. Hyperalgesia,
Louder, louder.
the pain by hyperalgesia, it becomes a little tricky area. There's a psychological component in it, and there's a medical component in it. So if you understand that the animal is in chronic pain, assume that it will be a issue for you. You have to first approach the animal very gently. Um, you will probably have to use the owner's help to be able to examine the animal. If it's possible, you can give them like you can. There's something called as a fear-free certification program, which tells you before the animal comes to you, you can give them a medication at their home. So that is something which you would consider. But sometimes you're caught with it unexpectedly. At that point of time, it's your calmness and your maturity of the situation which will help you deal with it. Because it's more of a perception rather than actual pain. So it will be a decision you make if you're not aware of it right over there. For example, I will tell you, cats they come to you, they are afraid of the situation, and small thing kind of. So you have to do something which the owner does before he comes. Half an hour before there's a fear-free program. You give medications before they come. Um, so those are things which you need to do to make sure that you don't get into trouble.
Okay, one more question, Dr. Brad. Can you tell more about thermal sensing procedure of pain assessment?
Okay, thermal sensing procedure. I'm not an expert in it. We try to not me, but one of my relatives was launching a company which didn't succeed. what they're doing is they are basically checking the amount of energy being excreted, or they are measuring the energy and taking a picture of that. Based upon that, they perceive that this area is more painful. Thermal imaging is still in its infancy. They are, I have not seen too much of it in clinical medicine, even in advanced hospitals, but it's coming up. My idea of talking about it is because you guys are fresh graduates, so you should understand what trends are coming up. It's something which I believe will be very effective. The machine is very expensive right now. Not too many machines are being used here, but it they measure the amount of energy excreted from that particular part of the body and measure pain according to that. It
Okay, one
theoretically it
last
makes a lot
question
of
from
sense.
one last question from students. Is there any scope of acupuncture therapy in animals in India? Now, how can Dr. Brar answer about in India? He is based in Canada, so how
But
can anyway
what I can
go
say
to
is that yes, if it works here, it should work in India too. If you know
yeah.
what points to use, it should work. Because
Okay, one
acupuncture is
question from
Chinese
me.
medicine.
Yeah, I know. Yeah, one question, Dr. Brar. You have used gabapentin, right?
Yeah.
So it is quite effective in neuropathic pain in humans. How do you find it in animals?
Oh, it's awesome. I love it.
Okay.
The,
Okay.
the,
And
the
how about
good effect is
toxins?
gabapentin is there are few side effects, not
Yeah.
regulated, can be used for like multiple things. Only thing is I have not seen an injection of gabapentin. I have only seen a like pills or powder of
Louder,
gabapentin.
louder.
I said I have never seen an injectable form of gabapentin. I don't know if it is available in
Hmm.
India, but I have never seen it. But I wish there was one.
It is available in India, but I think the cost is quite high. How about the cost in your
It's very
country?
cheap. The oral
It's
medication
cheap?
is very cheap.
I
One of
can't
the
hear you.
cheapest, one of the cheapest pain medications we get.
Okay, in India it is quite costly.
I don't know. Maybe
And okay, one last question. How often do you use COXIBs? I mean, selective COX-2 inhibitors.
all the time.
Huh?
All the time.
All the time.
All the time. Okay, okay. Okay, if there are no more questions, I'll thank Dr. Pushproop Brar for waking up so early. He got up at 4 a.m. in Toronto. Right
You know
now it
what?
is maybe 5:30 a.m. in Toronto.
No,
So
6
thank you,
a.m.
Dr. Pushproop
Okay,
Brar,
one
for
one last thing.
enlightening us.
One last thing. You should thank
Huh?
my wife. I said you should thank my wife because she had to move her room to go to the other room.
Okay. Okay, okay. So thank you for your effort, and I appreciate your lecture.
Anytime.
And if there are some more queries, I'll just get them over to you on your WhatsApp.
Yes. Thank you very
Thank you
much.
very much, Dr. Brad.
Dr. Sani, anything for you. You are such a good, nice guy.
Okay,
Okay.
thank
Thank you.
you.
Thank
So
you.
nice of
Bye.
you.
Bye.
Thank you. Bye-bye. Have a nice day.
Thank you, sir.